Hi, I'm Aisling and I'm going to talk to you about the importance of being active in birth. When you arrive to our birthing suite, we encourage and support you to have an active birth. By an active birth, we mean not being confined to the bed. You are free to move around and give birth in a position of your choice. Gravity will encourage the descent of your baby's head through the birth canal. Being active during your birth can reduce the length of the first and second stage of labour. It can reduce the risk of needing a caesarean section, an epidural, or intervention. Movement during your birth is encouraged for optimal fetal positioning, where your baby is in an optimal position for birth. For your baby to be in an optimal fetal position for birth, we encourage you during your pregnancy to be up, forward and open, UFO. Imagine your tummy is like a hammock. We want your baby to be lying in the hammock, not lying against your back. Using a birthing ball during pregnancy puts you in the UFO position and is really comfortable to sit onto. Some movements to use on the birthing ball to encourage optimal fetal position are pelvic tilts. This movement helps tilt your pelvis, thereby encouraging baby to move into an optimal fetal position and can help ease back pain in the early stages of labour. Figure of 8 or hip circles. This exercise encourages your baby to descend into the pelvis. It can also aid in relieving lower back pain. It is important to circle both clockwise and anti-clockwise in this movement. Forward leaning aids in tilting the pelvis, thereby allowing more room for baby to rotate into an optimal fetal position. Hip sways, gentle movement that opens up the pelvis to aid descent of your baby into the birth canal. It is safe to use the birthing ball for the duration of your pregnancy, unless you have been advised not to by your doctor or midwife. When you are in established labour and all your initial checks are complete, we encourage you to be as active as much as possible. You can move around your room, lean on the bed, sit on a ball, get into the all fours on the bed or on the mat. If you want to get out of your room, you can walk the corridor, use the stairs or use the bath. If you are getting continuous monitoring, talk to your midwife about the availability of the mobile CTG monitor. If you decide on an epidural as your method of pain relief, it is still important to stay as active as possible to encourage optimal fetal positioning until you have the epidural. Once the epidural is working effectively, we will ask you to move on your left side, right side, your back or the sitting position. Using a peanut ball in these positions helps the rotation and descent of the baby and can reduce the length of labour and the risk of a caesarean section. Whatever you choose for your birth, we will support you and help find you the optimal position for both you and your baby.